Welcome back to Mostly True Psychiatry. It's Dr. Mellon. We're working on schizophrenia and more specifically the positive negative symptoms split. And today we'll be talking about the negative symptoms. So this is a dichotomy, like the whole concept of positive symptoms and negative symptoms. It's a dichotomy just specific to schizophrenia. It's not for other diseases or disorders. A negative symptom is considered an absence or diminution of normal function, like a poverty of speech, flat affect, asocial, avolition, anhedonia, typical of schizophrenia. So it's kind of, that is a circular definition if I've ever seen one. Maybe I don't know what that term means, but that's what it sounds like to me. So the difference between positive and negative symptoms. So a positive symptom for schizophrenia basically is supposed to be an addition to normal experience, so delusions, hallucinations, whereas a negative symptoms is the absence or loss. So we've done videos on the positive symptoms. We're just going to be talking about negative symptoms now. This is a good verbal description, I think, this kind of setup for negative symptoms in schizophrenia, because you're just trying to say if it's present or not, right? It's one of the big diagnostic pieces. It's pretty common in schizophrenia, and it's, if you're not 75 with Parkinson's disease or something going on with psychosis, it's pretty typical just to schizophrenia, not a lot of other diseases when you're young. Negative psychotic symptoms means underactivity, slowness, lack of conversation, lack of friends, avoidance of others, poor personal hygiene, lack of self-care, lack of interest, and careless about personal appearance. So that's kind of like a good general description of what are negative psychotic symptoms. Kind of terms you might end up using are things like Alogia or Alogia, reduction in speech output. You've got Anhedonia, which is inability to experience pleasure in activities that would normally provoke pleasure. I actually take kind of contention to this. I think it's more appropriate to say they're passive or indifferent, kind of apathetic than anhedonia, because if someone has anhedonia, like you're thinking in depression, they used to do stuff, like they liked hanging out with their friends, playing sports, doing something, and they don't find that pleasurable anymore. And so anhedonia has a good place in depression. But with psychosis, people are fundamentally different with schizophrenia when they have negative symptoms. So I don't think it's fair to say that they're anhedonic, like, oh, they like it and they just don't now because of this. Like, fundamentally, their brain's different now. So like you think of somebody with dementia or something, if if you've had a major stroke and brain damage from a car wreck, you wouldn't normally call it anhedonia anymore. They're just indifferent, passive, right? A person with, like, a kind of a good example is there's a young man who I treated, or was part of the treatment team or whatever, with schizophrenia that very, very floridly psychotic, no question of schizophrenia. He was also doing drugs and knew from the voices he was hearing if he didn't chop off his arm, something bad would happen to his family, something horrible. And he ended up chopping off his own arm. And then I came into the picture maybe 3 or 4 months later. It's fully healed. He's got a nub there and stuff. And when I ask him questions about it and things, he just kind of tell me matter-of-factly. He's like, yeah, my arm got cut off. Well, doesn't that bother you, trying to go through stuff? And he's like, well, I'm right-handed. It was my left arm. Nothing. Doesn't upset him. Just kind of starts using the nub to do stuff when he's trying to use, like, another hand. Didn't bother him at all. So I don't think that's anhedonia. I think that's passive indifference. Diminished emotional expression, so just like facially, not having a lot of expressions. Flat affect is important. It's a buzzword for schizophrenia. So severe reduction in emotional expression, no emotional range. Some people like this idea of a scale, restricted affect, and then a little bit worse is blunted affect, and then you get to flat. A person with depression can have blunted affect. A flat affect is kind of like saying that if you write down your paperwork, oh, thunderclap headache, worst headache of their life, sudden onset, and then you don't do an image of their head, for bleeding. It's a buzzword. If you write it, there's an associated assumption with that term. So don't write flat affect on somebody unless you're using it as a descriptor for negative symptoms because they have schizophrenia. Impoverished thoughts, the paucity of speech kind of idea. Part of, like we'd already said, like the self-neglect, not taking care of yourself. So they're just descriptors. Negative psychotic symptoms are super important with schizophrenia. And the folks that it shows up in, I consider it a real strong sign of schizophrenia. The folks that it doesn't show up in, you got to be a little bit more careful, like the malingering and other problems, or just, it's just wrongly diagnosed kind of things. You have to be more careful. All right, I hope that was helpful. Next, I think we'll be going over probably like, where are they? So if we say diagnosis, schizophrenia. Next two things I want to go over, we're going to talk about disorganized speech, grossly disorganized behavior, just kind of as one piece, and then I'm going to go in at length, I think, on catatonia, because it's a specifier and it also has its own treatment and everything. All right, take care.